A question here. Can you please talk about the differences between IBD and IBS? I've been unresponsive to IBS treatments and now being evaluated for IBD. Great question. That one letter makes a huge difference when it comes to what you have. So IBS stands for irritable bowel syndrome, and whereas IBD stands for inflammatory bowel disease, and this includes Crohn's and ulcerative colitis. Now they can present similar ways, but they have vastly different other entities as well. So they can both present as either diarrhea, sometimes abdominal pain as well. But for IBS, irritable bowel syndrome, this is typically a clinical diagnosis. If I talk to you, get your history, do an exam, maybe do some limited testing, this can give us about a 95% predictive value of diagnosing you with IBS. And the most common symptoms can be pain. You have to have pain with IBS, with change in your bowel habits, either diarrhea or constipation, or a combination of the two. And this would allow us to have the diagnosis with IBS. Now, for some individuals, we may do blood testing, we may do scopes, but if we do a colonoscopy, we typically don't see anything on this scope that tell us that you have any inflammation going on. And this is very typical of IBS. And the treatment for IBS is based on your symptoms. If your symptoms are bloating or pain, we will focus on that. If your symptoms are diarrhea, we'll focus on that. If your symptoms are constipation, we'll focus on that. The good thing about IBS is that it does not kill you, nor will it lead to cancer. It sucks, it's not great, but it does not lead to anything bad. Very different from inflammatory bowel disease, including both Crohn's and ulcerative colitis. Now, in order to diagnose these things, you need a combination of different tests. You need blood testing, stool testing, imaging, and sometimes, and in fact, the gold standard will be a scope as well. We can actually see inflammation going on inside your GI tract. We can see ulcers, inflammation, narrowing, stenosis, a lot of scarring. And these combination of tests will allow us to diagnose individuals with Crohn's or ulcerative colitis. Now, in order for us to treat this, we have to put you on pretty strong medications for this. Medications that help to suppress the immune system or suppress the inflammation and keep everything at bay. And the problem with inflammatory bowel disease, or IBD, is it can lead to long-term complications. It can lead to colon cancer if left untreated. It can lead to profuse bleeding, anemia, fatigue, joint issues, other issues outside the GI tract, nutritional issues. It is a serious problem and a serious disease that really does need very effective and serious therapy. And that one little letter makes a huge difference in terms of what those particular symptoms are. If you have a question about IBS or IBD, comment down below as well. I'd love to hear what you guys have to think. Or have you been diagnosed with one or the other? Or did you get a confused diagnosis? You're not quite sure exactly what's going on. Comment down below. I would love to hear what you guys have to say or think about that. If you're enjoying these videos, I really would appreciate it if you smash that like button, comment down below, and don't forget to subscribe to my channel where you can get great tips like you're watching in today's video. And guys, don't forget, let's talk about poop. Thank you, everybody.